Because of a drug called atropine, I still get to enjoy my kids. Atropine is a part of a class of drugs called antiarrhythmics and anticholinergics. Atropine is commonly used for dangerously low heart rate during bradyastolic cardiac arrest. Atropine can also be used to decrease saliva production before surgery, dilate the pupils, as an antidote for mushroom poisoning, and an antidote for overdose of cholinergic medications. How does atropine work, you ask? Atropine blocks the vagal effects on the SA node and the AV node, which increases the conduction through the AV node and increases the heart rate. Atropine is available in 4 different forms. It's available in a vial, a pre-filled auto-injector pen, pre-filled syringes, and an eye drop bottle. Common doses include, for bradyastolic cardiac arrest, 1 milligram IV push every 3 to 5 minutes with a maximum of 3 milligrams administered. For symptomatic bradycardia, 0.5 milligrams IV push every 3 to 5 minutes with a maximum of 3 milligrams given, or 0.04 milligrams per kilogram for adults, or 0.02 milligrams per kilogram for adolescents and children, with a maximum for children of 1 milligram. Atropine's therapeutic effects include an increase in heart rate and stroke volume, dilation of the bronchioles, a decrease in tone and motility in the GI tract, decrease in secretions in the GI tract, a decrease in saliva and lacrimation, and it constricts the arterioles. Some side effects are tachycardia, dry mouth, blurred vision, dizziness, skin rash, mucus in the airways, pyloric obstruction, and glaucoma. Adverse reactions include bradycardia, arrhythmias, hyper and hypoglycemia, hyponatremia, hypokalemia, anaphylaxis, skin rash, insomnia, and urinary retention. Atropine is contraindicated in patients who are allergic to this medication, who've had a heart transplant, and who are hyperthermic. Use caution in patients with hypertension, hyperthyroidism, coronary artery disease, tachycardia, congestive heart failure, benign prostatic hyperplasia, myasthenia gravis, and Down syndrome. Some information for nurses to consider. Do not administer slower than 1 minute. This will cause bradycardia. Doses less than 0.5 milligrams for adults and 0.1 milligrams in kids increases the risk of paradoxal bradycardia. Monitor for tachycardia. This may lead to ventricular fibrillation. Monitor INOs. This drug can cause urinary retention. Use in pregnancy only if needed, and use cautiously while breastfeeding. Atropine can have an effect on certain lab values. These values include an increase in BUN, a decrease in sodium and potassium levels, an increase or decrease in glucose levels, an increase or decrease in hemoglobin, and an increase in red blood cells and white blood cell counts. Be sure to report all adverse reactions to your provider. Ask your doctor about atropine today.